Members, Mrs Pam Cameron has given notice of an urgent oral question to the Minister of Health. I would remind members that if they wish to ask a supplementary question, they should rise continually in their places. The member who has tabled the question will be called automatically to ask a supplementary. Clerk, would you please read the question?
To ask the Minister of Health to outline the steps he has taken to safeguard against inappropriate access to personal data held on the COVID-19 vaccine management system.
And I call the Minister of Health.
Thank you, Mr Deputy Speaker. Mr Deputy Speaker, I was made aware of reports in local weekend papers of concerns over the amount of access to patient information held in the vaccine management system, or our VMS, that staff employed by the health and social care system actually have. I can assure members of this House that strict controls over access to information held in this and other HSC systems are in place. The VMS is used by a wide range of healthcare providers to maximise vaccine uptake, so it's important that those staff ensure safety checks are undertaken before each vaccine is dispensed and those checks recorded accurately. Controlled access to patient information is essential to ensure clinically safety and quality data. To help maximise uptake, vaccination has been provided by different healthcare providers, each of whom must be able to cross-check key details before dispensing vaccines. So controlled access to patient information is not unique to the vaccination system. Each of the healthcare providers and administrators who use the system are subject to security checks as part of normal employment processes. The access controls for our VMS vaccine administration system are managed by each Health and Social Care Trust, or GP practice or pharmacy, and that includes selection and training of all staff members and specifically requested that they are provided with access to the VMS system. All of these employers have professional and legal responsibilities on data protection. Mr Deputy Speaker, all actions undertaken by those using the system are logged and subject to audit, and that is a standard practice for all HSC systems.
I call Pam Cameron.
Thank you, Mr Deputy Speaker, and I thank the Minister for coming to the Chamber to answer this urgent oral. As he'll be aware, it has been reported by several senior health clinicians that in recent weeks a flaw in the relevant software led to a database containing the vaccination status of every resident in Northern Ireland becoming widely accessible, including to staff who were not medically trained, as well as those in temporary and administrative roles. These allegations raise serious concerns regarding personal privacy and data protection. So I wanted to ask the Minister, does he accept, given the serious and far-reaching impact the pandemic has had on fundamental freedoms, that a laissez-faire attitude to personal data is not only unacceptable but damaging to public confidence? And will he now refer this matter to the Information Commissioner's Office for independent investigation and commit to a comprehensive review of existing procedures?
I thank the member, but the people who are accessing this system, as I said earlier on, are all either managed and put forward to access the system by their employer, should that be an HSC trust, a GP or a community pharmacy. The access to information is necessary to ensure that anyone who is coming forward to either receive a booster dose or a third dose, that information is accessible across all manufacturers. There has been extensive engagement by the Information Commissioner's Office and national cyber security teams over securing the information. As required by GDPR, the vaccine management system developers implement and maintain appropriate technical and organisational security measures. That includes measures that meet the requirements of ISO 27001 and ISO 27018 to protect personal data, data processes, a data processor or sub-processor, or on its customers' behalf. And since it was first launched, once logged into a VMS, user actions are logged in an audit trail that creates create, view, update events on patients' details. So I think what I've asked is that if clinicians are indicating that people who should not be accessing the system are, it's up to them to come forward and actually indicate how they've been given access to the system, when it's very clear it should only be expressly identified and accessible to those who have been notified by their employer, should that be an HSC trust, a GP or a community pharmacy.
Anish Eram Cahill and Christy Slantja Colm Gilden Hon Councillor. I call the Chair of the Health Committee, Colm Gilden.
Gormagat, Lashkian Collier, and thank the Minister for his answer so far. And Minister, in the early months of the pandemic, the Health Committee did look at regulations that would allow recruitment outside of health workers to assist with vaccination. However, you've taken vaccinators largely from health and social care workforce, 121 from Belfast, 92 from Northern and 66 from Western. And given the pressure that's on that system, will you consider taking voluntary vaccinators from other sectors? And also, given that the dashboard indicates that GPs are providing by far the most vaccines and the pressure on GP appointments, can you commit to further extending the voluntary vaccinator cohort?
And I thank the member, and he'd be aware, I think I said last week, in regards to the PHA supplying some vaccinator support, but also that administrative support to the system as well. But I think the member is actually asking about the key crux of the vaccine management system, and that is if you receive your first or second dose in a GP, the community pharmacy, if you go there for your third dose or a booster vaccine, they have to have access to that information as well. So that's why we actually control healthcare providers and administrators who use the system, and they are subject to security checks as part of those normal employment processes. And that administration is managed by the Health and Social Care Trust, the GP practice, or the community pharmacy under their data protection protocols as well. So the next step, and the members are aware, we engaged with community pharmacy. They started the operation of being able to supply booster vaccines last month. There's now 240 community pharmacies across Northern Ireland can now supply booster and third dose vaccines as well. But they need the access of the information of where the person actually received their first and second dose to enable them to do that safely, both clinically and technically.
Next item, Sir Colin McGrath on Cancha. Call Colin McGrath.
Thank you very much, Mr Deputy Speaker, and thank you to the Minister for answering the questions so far on this important issue. And I suppose I'd want to just put on record that this is not about the vaccine or receiving it. That continues to be one of the most important things we can do at this moment in time. This is purely an issue of data and data protection. Can I ask the Minister, is there any difference to this data, how it's held and how it's accessed, to say other parts of the health service, for example, your GP or your dentist or other allied professionals who can get access to information electronically? And is there anything that the Minister thinks could be done to tighten up what has been referred to in the original question going forward?
I thank the member, and I haven't been made aware of the reports that were in the media over the weekend. I am disappointed, having checked back, that some of the answers and additional information that we as a department actually provided weren't actually utilised in that article as well, which would have addressed some of the concerns that have been raised today. Because, as I've said, as required by GDPR, the VMS developers implemented and maintained the appropriate technical and organisational security measures, and that includes measures that meets the requirement, as I said again, of ISO 27001, ISO 27018 to protect personal data, its processors, as a data processor or sub-processor on its customers' behalf. So once logged into the VMS, a user's actions are logged in an audit trail, which includes create, view, update events on a patient's details. So that would be similar to all our health and social care systems equivalent. The difference is this one covers the entirety of Northern Ireland and can be expanded, because as we've seen, people seeking their first, second, third, even booster vaccines are going to different locations as to where it's accessible. So whoever's administering it has to have the information of what they've received and when they received it to make sure they are compliant safely and technically.
I call Alan Chambers.
Deputy Speaker, I'm sure that the Minister will share my concerns that there may be negative impacts of stories of this nature that may actually discourage people coming forward to be vaccinated. My question to the Minister is, will he confirm what steps his department has taken to protect patient data, and can he confirm that no data breach has actually occurred?
I thank the member in his last point first. I can confirm that no data breach has actually occurred. I think even the report in the papers talked about hypotheticals. A full data protection impact assessment of the vaccine management system has been carried out, and that can be actually found online at the COVID-19 hscni.net DPIA-NI vaccine management system. There is also a published privacy notice regarding data, and that can also be found on the department's website at COVID-19 hscni.net vaccine service privacy notice. It's in the build of the vaccine management system. Security and privacy have always been a key consideration throughout, as with all our systems, and the system has been through end-to-end security assessment and penetration testing.
I call Paula Bradshaw.
Speaker, and thank you, Minister, for coming to the Chamber this afternoon. I'm just wondering whether this vaccine management system is being used or could be used to identify which health and social care staff have or have not been vaccinated, and whether you intend to use it to actually target those areas where there is a deficiency in uptake.
I thank the member for her question, but that system wouldn't actually, as far as I'm aware, include employment status of an individual, and for it to be used in that sphere would actually be outside of what we've agreed with the Information Commissioner. This is purely a technical and medical vaccine management system, not one that can be used retrospectively for querying in regards to who has and who hasn't. And I think that seems to be where some of the misconception of the article over the weekend has come from.
I call Deborah Erskine.
Thank you, Mr Deputy Speaker, and I thank the Minister as well for his answers so far. When stories like this do appear, it does create fear, and I would agree with my colleague there whenever they say, that we should be encouraging people to come forward and get their vaccine. That's vitally important in combating COVID-19. So just to be categorically clear, Minister, does the Department have an access control policy, particularly when dealing with special category data such as medical records, and is this system in line with that policy, and if not, why not?
I thank the member, and I'll refer back again. The full data protection impact assessment of the VMS system has been carried out and can be found, and I'll share the website link with members of the Health Committee so that they have access to it as well. There's also the published privacy notice regarding the data that can be found as well, and as I said earlier, in regards to the health and social care systems that we use, the vaccine management system was based on that crux and the same requirements as per GDPR, because the VMS developers have implemented and maintained the appropriate technical and organisational security measures. And as I said again, that includes the measures that meet the requirement of ISO 27001 and ISO 27018.
Iarna Lewis Kelly Hun Cancha called Lewis Kelly.
Thank you, Deputy Speaker, and thank you, Minister. I can't wait to get my booster vaccine, and I hope that many others take up the opportunity. But Minister, today your department published stats which told us that in the last 24 hours, 11 people have lost their lives due to COVID, and there are further 44 people in ICU beds. God forbid there's any accident or anything that somebody belonging to us needs an ICU bed. And as I understand it, the majority who have died and the majority in ICU are unvaccinated. So, Minister, can you use this opportunity to join with us in the SDLP to call for people, if they haven't already yet received their vaccine, to do so without delay?
And I thank the member for that, and I suppose what concerned me in regards to where this story actually went over the weekend, that it could actually deter people from coming forward to receive their vaccine because of a misconception that their details will be widely publicised, which it's not. And they won't be, and I hope the assurances that I've given Mr Deputy Speaker in the answers to this question will do that, because we're now engaging with those people who are through the last yards, that need convincing, need that bit of additional support actually to come forward to get their vaccine. But I agree with the member in regards to encouraging everyone who can still come forward, not just to receive their booster or their third dose, but if there's still those who are hesitant about receiving the first dose, that they do come forward and get it, plus also take up their flu vaccines as well. The last data that was actually published by the IAD within my own department showed that those inpatients that we have that are currently under 50-year-old, 75% of them are unvaccinated. So an inpatient under 50 is 15 times more likely to be a COVID inpatient, that is 15 times more likely to be unvaccinated than those who have received the vaccine. Of those inpatients over 50, they're 5 times more likely to be unvaccinated than vaccinated. So it does show the benefits that vaccination does have, and I would be concerned that anyone is put off by what they may have read. But I want to address their concerns in regards to the benefits of vaccination, but also the security of their data on the vaccine management system.
I call Roy Beggs.
Thank you, Deputy Speaker. GDPR and contractual arrangements will require GPs, trust employees and pharmacists to handle confidential personal information with great care. So my question, Minister, is would you confirm that each time anyone would access anyone's personal records, There will be details of who accessed it, and no doubt at what time the access occurred, and that anyone who breached that confidential arrangement would be creating a serious offence which could have implications for their employment.
And I thank the member that the point he makes is the vaccine management system and accessing it is no different from accessing any other healthcare record. The only people who can log on and access the vaccine management system are licensed registered users who are healthcare professionals directly involved in the delivery of the COVID-19 vaccination programme. And that follows requests from the organisation concerned or who has employed them or engaged them, should that be trusts, GP practices or community pharmacy, because user accounts are only granted to those for whom it is necessary, and that's to ensure safe and efficient delivery of the COVID-19 vaccination programme. The VMS is a clinical system, and this is clearly stated to all users when they log on to the platform. So all of these users are used to working with clinical systems and have access to patient data as part of their duty in the provision of patient care. These users are fully aware of the information governance which is associated with such activity, and all activity on the VMS system is logged and auditable.
I call Jim Allister.
Can the Minister give some indication of the quantification of that? Are we talking dozens, hundreds, thousands of registered users? And one of the aspects of the press report at the weekend was a claim that the updated system was less efficient or didn't have the audit facility. Can he say categorically that's not correct? And does the audit system enable the overseers to see who and when someone accessed? Or is there any grey area about that?
And I thank the member for seeking that clarity. Since it was first launched, once logged on to the VMS system, user actions are logged in an audit trail, and that includes whether they're creating a record, viewing a record, or updating events on patients' details. The original version, which the member refers to, was the system provided by GP surgeries with access only to their patients. Phase 2 of the VMS, which was rolled out in September, actually was done so to support the delivery of boosters, because there needed to be cross-checked vaccine history with any provider location, and that required the inclusion of the expanded search criteria. So access to citizens' data is monitored by security and authentication mechanisms and data access by clinical users, VMS administrators and development staff. It is also recorded for audit purposes, and employers have the responsibility to ensure that only legitimate access is undertaken to support legitimate clinical processes. I don't have the number with me in regards to who has access to that system, but I'll get it to the member in writing.
I call Rosemary Barton.
Thank you, Minister, for your answer so far. Minister, is it a case that it's only because the VMS has been expanded to include vaccine history across any location? Many thousands of people are now able to be vaccinated in our community pharmacists.
The member is correct, because as I said in an earlier answer, the vaccine management system is now to ensure the vaccine history of anyone who is now coming forward for their booster or third doses, or even their second doses as well, so that whoever is administering it can check that medical history as well. So that's why in Phase 2, as I said to Mr Allister, that was rolled out in September, actually includes that additional data, so that it allows the cross-checking of vaccine history with any provider location, so that that can include the expansion of the vaccine programme in the next steps.
That, members, concludes the urgent oral question.